Today we're going to talk about musculoskeletal TB and how the modern diagnostics have affected this, because there has been a change in the way we diagnose TB all over, and it is going to impact the diagnosis of TB even in the case of orthopedic cases or musculoskeletal TB. So I bring you greetings from Delhi, and I will talk about this. The plan of my talk is to talk of what are our current tool for TB diagnosis in the context of clinical presentation. And when we say bone and joint TB, we are covering a huge set of involvements from upper limb, lower limb, small joints, large joints, osteomyelitis, pot spine, and therefore the clinical presentations would be quite variable when it comes to the local issues. We'll go by to a little bit more in details on that. What are our tools of diagnosis? Some are still prevalent, some are with the older generation, not necessarily with the newer generation, but are available in the market. And then there are newer tests, which are not so new, yet new as compared to the disease. And in the past decade, they have become more popular. And what is their role in bone and joint TB, particularly spinal TB? And we will also be talking a bit about radiology of bone TB, particularly the spine TB, because the diagnosis of bone and joint TB requires a combination of all this. So let's go further and learn about them. So if one looks at the classical pyramid of TB diagnostics, it always starts with the characteristic symptoms. So you have a chronic presentation or a typical presentation with constitutional symptoms, which makes you think that, okay, this may be likely to be tuberculosis. Then we support that diagnosis. So let us learn about these in detail. If we look at the classical pyramid of TB diagnostic, we start with characteristic symptoms. Particularly in the context of TB, they usually present with the chronic constitutional symptoms, but that may not necessarily happen in all patients with bone TB. But presence of constitutional symptom of prolonged illness or a cold abscess does help us think of tuberculosis. And then you need some tests to support it. The tests which are used were earlier a Montu test, which was very common. Now we have interferon gamma release assays like quantiferon gold test or TB spot test, about which we'll be talking, which we often use as a supportive therapy, a supportive diagnostic. And then you have imaging, which forms the major basis of diagnosis, and final confirmation either by microbiology or histopathology. We learn about contribution of each one of these as we go by. And as you go up this pyramid, the sensitivity decreases, but specificity increases.